Hey everyone, do you guys have any discomfort in the areas that Sebastian is pointing to here? Maybe kind of into the glute, down the hamstring, if it does go past the knee, or even into the heel or bottom of the foot. We are covering today how hip impingement can be creating sciatica. My name is Dr. Dawn. This is Sebastian, Dr. Sebastian. We work at Performance Place Sports Care, and we are the locally world famous chiropractors.
Locally world famous.
Yes. So we're going to show actually a little more demonstration just to kind of get you guys to be able to visualize what exactly is going on here, okay? So Sebastian, show them that kind of quad rocking thing that we were talking about here.
Okay.
And so I want you guys to imagine this just kind of a flipped over version of a squat. Say you are a very active person. Even if you are not active, you're somebody who kind of gets up and out of a chair every day, gets up and off a toilet every day. You are squatting when you go throughout your movements throughout the day. And so most of the time you pick a typical foot position or a hip position and you get into this movement here. So when Seb's knees are a little bit closer, let's go even closer. Look at what happens at his spine a little bit sooner. He starts to round, okay? So let's start you actually at 90. Come up even more. Good, so here's neutral, okay? And wait until see that he starts to kind of round through his spine here. It's a little bit sooner than usual, okay? And then if we come back up to 90, but maybe take the knees a little bit wider. Perfect, and then sit back. He can get a lot further here. Actually, at no point is he even flexing through the spine. So what we're really challenging there is the hip joint sockets. And at certain positions, bone on bone of the femur and the pelvis come together a lot sooner than if your knees were just a little bit wider. Everybody's hip anatomy is a little bit different, but a lot of times when knees are close, so you're trying to force yourself to squat with your knees close, toes straight, all kinds of stuff like that. If you're getting low back pain, sciatica type pain when doing that, I would say maybe simple modification is go feet a little bit wider and see what happens.
Yep. So hip impingement will limit range of motion of the hip at some point. The knees together approach that we just did kind of simulates a limitation of hip range of motion, which can create the low back round, which can create sciatica. Now, there's many different reasons for sciatica and low back pain. This is just one of them, and it's categorized as flexion intolerant low back pain, or sciatica rather. And we actually have a webinar we just created on this. It's in the upper corner. It's going to cover the 3 different categorizations of low back pain, and sciatica is in there as well. So we want you to learn a little bit more about it so you guys can hopefully solve your problem. So subscribe to the channel. We have other videos on sciatica on our channel. Use the search bar. And you can always come see us in person or virtual. Dawn's great at virtual doing sciatica, right? Mm-hmm. Mm-hmm. We'll see you guys next time.